Have you ever noticed something off with your body but brushed it away, thinking it's just another sign of getting older? That strange pain that comes and goes, the unexplained weight loss that you secretly enjoyed, or that nagging fatigue that just won't quit, no matter how much you rest. I've seen this scenario play out hundreds of times in my years working with elderly patients. Just last month, I met with Robert, a 75-year-old retired teacher who came to see me only because his daughter insisted. For 6 months, he'd been feeling unusually tired, losing interest in his beloved gardening, and dropping weight without trying. He thought it was just part of aging, that these changes were normal and expected. What Robert didn't realize, and what so many elderly people miss, is that these subtle changes were actually his body desperately trying to send him warning signals. By the time most seniors recognize something is seriously wrong, the cancer has often advanced to a stage where treatment options become limited and outcomes less favorable. Today I'm sharing the 5 silent signs of cancer that 90% of elderly people ignore until it's too late. These aren't the obvious symptoms everyone knows about, but the quiet whispers your body makes that are all too easy to dismiss, especially when you've reached your golden years. Stay with me until the end, because knowing these silent warning signs could literally save your life or the life of someone you love. The information I'm about to share has helped countless patients catch cancer early when treatment is most effective and chances of full recovery are highest. This isn't about creating fear, but about empowering you with the knowledge that could make all the difference. Hey there, I'm so glad you're watching today. If you're joining from somewhere in the US or around the world, drop a comment letting me know where you're tuning in from. I love seeing our community spread across different places. And if you have any questions as we go along, feel free to ask in the comments section below. I'll do my best to address them in future videos. If you're new here and want to stay informed about crucial health information for seniors, consider subscribing and hitting that notification bell so you never miss our weekly videos on senior health and well-being. I'm going to take a brief pause here because I want to ask you something important. Have you or an elderly loved one ever experienced a health symptom that was ignored or dismissed as just normal aging? What physical changes have you noticed that caused concern but were maybe pushed aside? You know, many seniors and their families struggle with knowing the difference between normal aging and potential warning signs. It's an incredibly common and deeply frustrating experience. I understand how confusing and sometimes scary it can be trying to interpret what your body is telling you, especially when healthcare providers might not always take senior concerns seriously. If you feel comfortable sharing, please copy this phrase, "The symptom I wish I hadn't ignored was," and finish with your experience. Your comment might be exactly what someone else needs to read today to take their own symptoms seriously. Plus, your experiences help me create content that addresses your real concerns and questions. Remember, this is a judgment-free space where your voice and experiences truly matter. The first silent sign that's frequently overlooked in elderly people is unexplained weight loss. Now, we need to be very clear about what we mean here. I'm not talking about losing a few pounds after increasing your activity or making dietary changes. I'm talking about noticeable weight loss when you're not trying to lose weight. Many seniors actually feel pleased when they drop weight without effort. In a culture that celebrates thinness, it can seem like a silver lining of aging. Some even receive compliments from friends or family, which reinforces the idea that this weight loss is positive. However, unintentional weight loss, defined as losing 5% or more of your body weight within 6 to 12 months without trying, is a classic early warning sign of several types of cancer. According to research from the American Society of Clinical Oncology, approximately 40% of cancer patients report unexplained weight loss at the time of diagnosis. This percentage is even higher in cancers of the pancreas, stomach, esophagus, and lung. Why does cancer cause weight loss? There are several mechanisms at work. Cancer cells demand enormous energy to fuel their rapid growth. They essentially steal nutrients from healthy tissues, creating a state of negative energy balance. Many tumors also release substances called cytokines, which can suppress appetite, alter how the body metabolizes nutrients, and increase the breakdown of muscle tissue. This complex process is sometimes called cancer cachexia, and it's particularly common in advanced stages. Another factor is that tumors in certain locations like the stomach, esophagus, or pancreas can physically interfere with eating digestion or nutrient absorption. Have you noticed that your pants are looser or your watch slides around on your wrist more than it used to? These subtle changes might be more significant than you realize. What makes this symptom particularly tricky for elderly people is that some weight loss is often considered normal with aging. Healthcare providers might not raise immediate concerns about moderate weight loss in seniors, and unfortunately many elderly people don't even mention it during checkups. They might think it's just part of getting older, or even a positive change. One patient of mine, Martha, an 82-year-old widow, lost nearly 15 pounds over 3 months. She was actually pleased about it, as arthritis in her knees had been bothering her, and she thought less weight meant less pain. It wasn't until her daughter noticed how loose her clothes had become that she mentioned it during an appointment. Further testing revealed early-stage pancreatic cancer. Because we caught it before she developed other more serious symptoms, Martha was able to undergo successful treatment. If you or an elderly loved one has experienced unintentional weight loss of more than 5 to 10 pounds over a few months, it's essential to mention this to a healthcare provider. While it might not be cancer, other serious conditions like thyroid disorders, depression, digestive diseases, or other metabolic problems could also be responsible. The key is not to simply accept unexplained weight loss as a normal part of aging, but to investigate its cause. Keep a record of weight changes, notice if clothes are fitting differently, and don't hesitate to advocate for appropriate testing. Early detection truly can make all the difference. The second silent warning sign that elderly people frequently attribute to normal aging is persistent, unusual fatigue. We all get tired from time to time, and it's true that energy levels naturally fluctuate as we age. But the fatigue associated with cancer is different. It's a profound exhaustion that doesn't improve with rest. It's the type of tiredness that interferes with daily activities and persists for weeks or months, not just a few days. Cancer-related fatigue affects between 80–100% of cancer patients, according to the American Cancer Society, making it one of the most common yet overlooked early warning signs. This isn't the kind of tired you feel after a poor night's sleep or a busy day. It's an overwhelming whole-body exhaustion that seems disproportionate to your activity level. As one of my patients described it, "It feels like all the energy has been drained from my body, like I'm moving through molasses, even when doing the simplest tasks." Why does cancer cause such profound fatigue? The reasons are complex. Cancer cells are metabolic powerhouses that consume enormous resources. They compete with healthy cells for nutrients, creating a state where your body is essentially running on empty. Additionally, many cancers trigger an immune response as your body attempts to fight the disease. This immune activation requires significant energy and produces substances that can make you feel exhausted. Certain cancers also disrupt hormone levels, which can affect energy regulation throughout the body. Blood cancers like leukemia and lymphoma frequently present with fatigue as an early symptom because they affect red blood cells which carry oxygen throughout your body. Less oxygen means less energy for every cell. Cancers that spread to bone marrow can have similar effects. What makes this symptom particularly deceptive for seniors is that mild fatigue is often considered just part of the aging process. Many elderly people gradually reduce their activities to accommodate decreasing energy levels without realizing this change might signal something more serious. Healthcare providers might not probe deeply when an older adult mentions feeling more tired, especially if there are other chronic conditions present that could explain the symptom. Consider my patient James, a 79-year-old who had always been remarkably active for his age. He still mowed his own lawn and walked 2 miles every morning until gradually he found himself needing more breaks, eventually cutting his walk short and finally skipping days altogether. His wife noticed the change, but James insisted he was just getting older. It wasn't until he fell asleep during his grandson's birthday party something completely out of character that his family insisted he see a doctor. Tests revealed colorectal cancer, which was successfully treated once discovered. If you or an elderly loved one has experienced a significant change in energy levels that persists for more than 2 weeks, it deserves medical attention. This is especially true if the fatigue is accompanied by any other symptoms on this list. Keep a journal tracking energy levels throughout the day, and note any patterns or triggers. This information can be invaluable to healthcare providers in determining the cause. While fatigue has many possible explanations, including medication side effects, anemia, depression, or other chronic conditions, persistent, unexplained exhaustion should never be dismissed as simply getting older. The third silent sign that elderly people often ignore is persistent, unexplained pain. Pain is complex and subjective, which makes it particularly challenging as a diagnostic. Clue: many seniors already live with some degree of chronic pain from conditions like arthritis, osteoporosis, or neuropathy. This background of normal pain can make it difficult to recognize when a new pain pattern emerges that might signal cancer. According to the National Cancer Institute, pain is present in approximately 20 to 50% of patients with newly diagnosed cancer, though this varies significantly by cancer type. As the disease progresses, the prevalence of pain increases, with up to 80% of patients with advanced cancer experiencing significant pain. The key difference between normal age-related pain and pain that might signal cancer is the pattern and persistence. Cancer pain typically has one or more of these characteristics. It appears without a clear cause, persists longer than expected, follows unusual patterns, intensifies over time, doesn't respond to usual remedies, or occurs at rest rather than with activity. Different types of cancer cause different types of pain. Bone cancer, or cancer that is spread to the bones, often causes a deep aching pain that may worsen at night. Pancreatic cancer frequently causes mid-back pain that can wrap around to the upper abdomen. Brain tumors can cause persistent headaches that might be worse in the morning or wake you from sleep. Colorectal cancer might cause abdominal cramps or feelings of incomplete bowel movements. What makes this symptom particularly problematic for elderly patients is the tendency to attribute new pain to existing conditions. A senior with arthritis in multiple joints might assume that a new pain in the hip is just more arthritis when it could actually be referred pain from a kidney or colorectal tumor. Healthcare providers might make the same assumption without investigating further, especially if time during appointments is limited. Consider my patient Eleanor, an active 77-year-old with a history of osteoarthritis. She developed increasing pain in her right shoulder, which she and her doctor initially attributed to her existing arthritis. Physical therapy and anti-inflammatory medications provided little relief, but she continued to manage, assuming it was just getting worse with age. It wasn't until the pain began waking her at night, despite prescription pain relievers that her doctor ordered imaging, which revealed lung cancer that had spread to her shoulder joint. If you or an elderly loved one experiences new pain that doesn't fit previous patterns, persists beyond 2 weeks, progressively worsens or occurs at rest, it warrants medical attention. Be particularly attentive to pain that wakes you from sleep, doesn't respond to over-the-counter remedies, or is accompanied by other symptoms like weight loss or fatigue. When speaking with healthcare providers, be specific about how this pain differs from your usual aches and pains. Note its location, character, timing, and what makes it better or worse. Advocate for appropriate investigation rather than accepting quick assumptions that it's just part of your existing conditions or general aging. While pain has countless causes, and most pain does not indicate cancer, persistent, unexplained pain always deserves proper evaluation. The fourth silent sign commonly overlooked in elderly people is changes in bowel or bladder habits. Our bathroom routines aren't typically dinner table conversation, which means these changes often go undiscussed, even with healthcare providers. This silence can be dangerous, particularly for seniors who might attribute these changes to aging when they could be important warning signs of cancer. Colorectal cancer is the third most common cancer in both men and women in the United States, with incidence increasing significantly after age 50. Early-stage colorectal cancer often presents with subtle changes in bowel habits, such as new-onset constipation or diarrhea, narrowing of stools, blood in the stool, which may appear bright red or make stools look very dark or tar-like, or a feeling of incomplete evacuation after bowel movements. Similarly, changes in urination can signal bladder or prostate cancer. These might include increased frequency, urgency, difficulty starting or stopping urination, weak stream blood in the urine, or pain during urination. According to the American Cancer Society, most bladder cancers are diagnosed in people over 55, with the average age at diagnosis being 73. What makes these symptoms particularly easy to dismiss in elderly people is that some changes in elimination are common with aging. Many seniors experience increased urinary frequency or mild constipation related to medication side effects, decreased mobility, fluid intake changes, or weakening pelvic floor muscles. This normalization of symptoms can lead both patients and providers to miss important warning signs. Additionally, many older adults are uncomfortable discussing elimination problems, viewing them as embarrassing private matters or simply an inevitable part of growing older. Take my patient George, for example, a 75-year-old retired accountant who began experiencing increased constipation, alternating with loose stools. He mentioned it briefly during an appointment, but downplayed the symptoms, saying, "I guess this is just what happens when you get to my age." His doctor suggested increasing fiber and fluids without further investigation. It wasn't until George noticed blood on his toilet paper 3 months later that he returned for more thorough evaluation, which revealed a tumor in his colon. Fortunately, we were able to treat it successfully, but earlier detection would have meant a simpler treatment course. If you or an elderly loved one experiences persistent changes in bowel or bladder habits that last more than a few weeks, it's important to discuss these changes openly with a healthcare provider. Be specific about what has changed, including frequency, consistency, color, urgency, or associated symptoms like pain or bleeding. Don't accept aging as the only explanation without appropriate screening, especially if you're due for routine cancer screenings like colonoscopy. While many factors can cause changes in elimination, from diet and medication to infection and muscle weakness, persistent, unexplained changes should always prompt medical evaluation. Remember, these conversations might be briefly uncomfortable, but they could quite literally save your life. The fifth and final silent sign that elderly people frequently ignore is unusual bleeding or discharge. Any bleeding that occurs outside of normal patterns deserves attention, but it's particularly concerning in elderly individuals. This category includes a wide range of possible symptoms: blood in urine or stool, unexpected vaginal bleeding in postmenopausal women, coughing up blood, unusual nipple discharge, bleeding from the gums or nose without clear cause, or unusual bruising or bleeding under the skin. According to the American Cancer Society, unexplained bleeding is often the first noticeable sign of cancer in an organ or tissue where a tumor has developed. For instance, coughing up blood, hemoptysis, could indicate lung cancer, while blood in the stool might signal colorectal cancer. Postmenopausal vaginal bleeding is considered a red flag for uterine cancer until proven otherwise. Unusual bleeding occurs with cancer for several reasons. Growing tumors can erode into blood vessels, causing bleeding. Cancers can also interfere with the body's normal clotting mechanisms. In some cases, like leukemia, the cancer directly affects blood cell production, leading to easy bruising or bleeding. What makes this symptom particularly dangerous for elderly people is that many dismiss or rationalize unusual bleeding. They might attribute bloody stool to hemorrhoids, gum bleeding to dentures, or increased bruising to blood thinners without seeking medical evaluation. Healthcare providers might make similar assumptions, especially if the patient has conditions or takes medications. That could potentially explain the bleeding. Consider my patient Dorothy, an 81-year-old, who noticed small amounts of blood when she urinated. She didn't mention it during her regular checkup, assuming it was just part of getting older and possibly related to the minor urinary incontinence she had experienced for years. When she finally mentioned it to her daughter 6 months later, who insisted she see a doctor, tests revealed bladder cancer. Had she reported the symptom when it first appeared, the cancer would likely have been caught at an earlier, more treatable stage. If you or an elderly loved one experiences any unusual bleeding, no matter how minor or infrequent, seek medical attention promptly. Don't assume it's normal or related to existing conditions without proper evaluation. Be prepared to advocate strongly for appropriate testing, as unusual bleeding always warrants investigation. When discussing these symptoms with healthcare providers, be specific about when the bleeding started, how frequently it occurs, how much bleeding there is, and any associated symptoms. While many causes of unusual bleeding are not cancer, the possibility should be ruled out, especially in elderly individuals who are at higher cancer risk. Remember that early detection through prompt reporting of symptoms remains one of our most powerful tools against cancer. We've covered the 5 silent signs of cancer that elderly people often ignore: unexplained weight loss, persistent unusual fatigue, unexplained pain, changes in bowel or bladder habits, and unusual bleeding or discharge. Each of these symptoms on its own might have many possible explanations, but they should never be dismissed as simply part of getting older. They deserve proper medical attention, especially when they persist beyond a few weeks, occur without clear cause, or appear alongside other symptoms. I want to emphasize that knowing these warning signs is not about living in fear. It's about empowerment. It's about recognizing that your body communicates with you and learning to listen to those signals with wisdom rather than dismiss them. Early detection remains one of our most powerful advantages in successfully treating cancer. When caught in earlier stages, most cancers respond better to treatment, with less intensive interventions and better overall outcomes. This is particularly true for elderly patients who may have less physiological reserve to withstand aggressive treatments. Thank you so much for staying with me through this important information. If this video has helped you understand these silent warning signs, please give it a like and share it with someone who might benefit from this knowledge. Cancer doesn't have to be a death sentence, especially when we catch it early. Your health matters at every age, and you deserve to have concerning symptoms taken seriously. If you haven't already, please subscribe to our channel for more evidence-based health information, specifically designed for seniors and their loved ones. Remember, knowledge is power, especially when it comes to your health. No one knows your body better than you do. Trust those subtle changes that don't feel right and advocate for the attention you deserve. You've lived a lifetime gaining wisdom. Use that wisdom to be your own best health advocate. Until next time, take care and stay vigilant about your health. After all, the golden years should truly be golden.